Hello, everyone, and welcome to this week's edition of Ask the Expert. My name is Ashley Baldwin from the Department of Communications at the Pan American Health Organization. And today I'm going to be talking to two of my colleagues at the DC headquarters about COVID-19, older adults and youth. So very specific demographics will be discussed today. I'm joined with Dr. Enrique Vega, who's the Chief of the Health Life Course Unit at PAHO. Hi, Enrique. I think Enrique is muted, so we're going to try and adjust his mic in the meantime. There we go. And Dr. Sonia Café, who's the Advisor on Adolescent Health at PAHO. So welcome to you both.
Thank you.
So I'm going to ask you a couple of questions to get started, but the idea with these Ask the Expert sessions is really that audiences that are watching across the Americas ask the questions that they have. So I'm gonna ask if anyone has anything that they would like to know about older adults or about young people in the context of COVID-19. If you pop your question into the comments section, then we will endeavor to get to it within the next 40 minutes of this session. But while we're waiting for some of those questions to arrive, we've heard a lot about specific risk groups when it comes to COVID-19. And we know that when it comes to severe disease, for example, the older population, so older persons that are more than 60 years old, are much more likely to get severe disease. I wonder, Enrique, if you can talk to us a little bit about why older populations are a bit more vulnerable to COVID-19.
Thank you, Ashley, for the question. And we still are learning about what happened and what the older persons are majorly in risk to die. As we see the data from Europe and we see the data from North America, we see that more than 70 or 80% of older persons are they are concentrated the people who are dying from the COVID, and especially the people who are living in nursing home. In many of these countries and in US and Canada too, represent 40 or 50% of the death in these countries. So we are learning that, of course, that the people who are highly dependent of care, people that are very functional limited in their activities of their daily living, are more in risk. Many of them have several chronic conditions, especially diabetes, hypertension, and others. But at the same time, we are learning that there were a lot of weakness in the way that the health system and the health service were capable to detect them in the early way, because the symptomatic or the symptoms are not the same that they usually are described in young adults. Many of the older persons have not fever, or many of them has not cough, and they are stuck the symptoms with other kind of symptoms, weakness, functional decline, or something like that. And many of the time, when the health service detect them, they are very advanced in the disease process. So there is a combination of factors: the physical and biological weakness associated with age and many disease, but at the same time, lack of capacity from our health service to manage these persons in properly way.
Right. And Sonia, so we know that when it comes to young people, they're not so predisposed to getting severe cases of COVID-19, and certainly not more severely ill cases of COVID-19. But they, of course, are still getting it, particularly young people with pre-existing conditions, and some young people without pre-existing conditions. So no one's immune to COVID-19 at all.
That's right.
But there are other factors, there are other health issues that young people are experiencing within the context of COVID-19. I wonder if you could talk to us a little bit about some of the particular challenges that are facing youth.
Yes, thank you, Ashley. And this is, you're right. Young people are less at risk for grave disease or for death, but they do get it in our region. By now, we have over 70,000 young people who have tested positive for COVID. And we have also seen hospitalizations, especially of those with underlying conditions such as cancer, diabetes, liver disease, etc. And so nobody is immune. They're all we're all at risk, and young people as well. But as you say, we are more concerned with young people about some of the mental health challenges that they might face, the psychosocial consequences of not only of COVID, but the repercussions of COVID that also create harm for them. We see increased risks of suicide, self-harm, substance use, say some of the what we call negative coping mechanisms that can have long-lasting effect on the health and well-being of young people, which of course concerns us.
And are these caused predominantly by, so I mean, a lot of countries, and PAHO is recommending that countries that are experiencing transmission, which I think are all countries in our region at the moment, implement public health measures. So when we talk about public health measures, you know, I guess the layman's terms, the terms that we're reading about in the newspapers are things like social distancing and lockdown and things like that. And I suppose that when you're a young person, that has a hugely disproportionate impact on education, on employment opportunities, on access to the services that you were mentioning, the mental health services and sexual and reproductive health services as well, Sonia. So I was just wondering, is it the lockdown context that's causing this negative implication on young people, and what can we do in order to address that?
There are two things, and thanks for the question, because of course, these public health measures that are necessary to reduce the risk, not only of contracting COVID, but also transmitting it to others, because a young person might become infected and have mild symptoms, and they infect another older adult in the household with more severe consequences. So that's also something of responsibility to keep yourself and your family safe. But beyond that, I think the life stage of young people puts them more at risk for some of the psychosocial consequences, because typically in a young person, an adolescent, their development, they're beginning to move away a little bit from the core of the family. And they, a lot of their development has to do with being with peers, being with others outside of the household. And now that has been reduced. And so even though, excuse me, the lockdown is affecting everybody, pardon, young people have this added challenge to their developmental stage. And so it's important, first of all, for us to acknowledge that this is an issue for young people, and then to take measures to try and help them get through this the best way possible. And some of the interventions, for instance, as PAHO, that we have done is we are organizing weekly hangouts with young people where they can connect, share their fears, share their concerns, just questions, have fun, because it is a need, a developmental need. And so I think part of our response on local level, on country level, has to be, how do we make sure, how do we reach young people and make sure that they do have a replacement mechanism to be social.
Mm. And I guess this is underlining the fact that physical distance doesn't necessarily mean social distance. There's
Absolutely.
many ways that we can get that interaction and even access certain services, educational services and what have you, without the need to be within 6 feet of each other, which is
Exactly.
good.
Yes, but of course it does mean adaptation, because
Right.
if you're not in school, nothing can replace the human interaction, right? So we also need to acknowledge and validate their feelings, saying, hey, we know that this is tough, this is hard. And being educated away from school, the remote, the distance education measures, they're there and they're good and they're necessary, but it's not the same. And so all of that we need to accept and try and help young people make sure that there are other ways, like innovative ways maybe to address their mental health issues, like helplines, programs. And so it's really a concerted effort to fill those gaps that have been created by the circumstances.
Right. And Enrique, so we've spoken a little bit about some of these, particularly mental health issues that young people are experiencing as a result of the measures that we're just having to take to protect ourselves and each other from COVID-19 transmission. But given that there's a lot of discussion around the fact that older adults are more likely to experience loneliness and certain mental health issues as well, I wondered if you could talk a little bit about measures that can be taken so that older adults are staying protected, but still being able to access the services and the interaction that they need.
Yes, actually, and thank you for raising this subject. I think that the first issue that we have is that we consider older person as an homogeneous group. And this is like the saying that we talk about young persons, and we consider the people from 0 to 30 as a unique group. And we consider the same one child of 1 year or one person of 25.
Right.
So when we are talking older adults, we are talking people over 60 that are the only responsible of economic of their home. They are responsible for their grandchild. And then, for instance, in US, 5 million older persons are responsible. It's the only responsible of their grandchild at home. So they are responsible for the economy, for bringing food, for cook for them, for organize their lives, so a lot. So we have a lot of kind of older person, and this is a very important sense. And of course they are pushed for a side effect of COVID that we are, and Sonja is mentioned very well. And of course the older person have in some way some resilience, that they are alive and giving more experience, giving more. They know how to balance, and they know the high risk that they are having with a COVID and many times. But this is not a short epidemic. We are not talking about the emergency that have 4, 5, 3 weeks. We are talking about months, probably years, that we will have a problem. So there is a lot of impact about the mental health, but about the physical health. The older person need to maintain function, need to have a high physical activity. They need to move. They need to have a special condition. They need to feel comfortable when around what they are doing. So I think that many of the requirements that the younger generation have also are necessary to maintain the mental and the physical health for older person as a side need of the COVID prevention.
So there's a lot of overlap, I guess, with the needs of these.
It is
broad demographics. Demographics.
One of the issues that we need to understand, and many of our homes in Latin America and the Caribbean are multi-generational homes. Right. And we are talking that in some of them 4 or 5 generations even are sharing the same space. And this is very difficult about the different needs that they need to cover in some physical space. In many of the occasion, they're very limited physical space. And when we are thinking about favelas in Brazil or or some areas in the Caribbean that are very, very complicated housing conditions, it is very difficult to learn how we could maintain this physical distance and how we cover all the needs we're talking about in these home conditions.
It's interesting the point that you mentioned about the multi-generational homes that we have here throughout Latin America and the Caribbean, because one of the questions that I wanted to ask is that, you know, we're getting a lot of young people on social media platforms and, you know, even when they're interviewed by the media saying, well, you know, there's a much less likely chance that I'm going to suffer from severe disease if I contract the coronavirus, COVID-19. So is it really that important that I follow the public health measures that are being recommended by international organizations and by governments? Do I really need to wash my hands that much? I wonder if you can talk about just how important it is that everyone, including young people, follows those public health measures, particularly given the context in which we're living in Latin America and the Caribbean with these multi-generational homes and family interaction and everything else.
Yeah, that is really, it has been a concern that through the initial messaging, young people, maybe some young people, not all, but got the idea that this does not affect me. I don't have to worry. And I remember in some countries, we received notice that it were initially the young people who were not complying with the rules because they had that perception that, you know, it's not important to me. We are trying to change that with our messaging, and I know countries are also making that effort because, as we mentioned in the beginning, one, you don't know if you happen to be that one young person who develops severe symptoms, and so it's for their own health, for your own health. Young people need to be careful, but then they live in households, and there might be a person, a younger, an older person with an underlying condition or a higher vulnerability, and then we share the responsibility to protect all the members and or a smaller child, because we know that the much younger ones can also be at elevated risk. And so I think for all young people, it's really important to maintain those measures for themselves and for those around them, those within the household and within their communities. And in some countries, they're beginning to open up. Young people are going back to school. And again, this creates another risk, you know, and a responsibility towards the peers in the classroom and others. So it's so important to continue to apply the prevention measures for themselves and for others around them.
Mm.
And actually, I want to make some extra comment what Sonja already mentioned, that in the region we are very concerned in PAHO about you know, for people who are dependent of care, especially older persons that are dependent of care, but there is a young person that also are due to disabilities or other things that they are dependent of care. The concept of physical distance is impossible because somebody must give them the food, somebody give them the bath, and they help them to move to the bath and everything. So the physical distance is a very complicated concept. And even so, what we are demonstrating, what happened in the nursing home or in the long-term care facilities in Europe and United States and Canada and the rest of the Asia, important older countries, we also in the region, we have more than, the nursing home, the long-term care facilities represent just 5% of people who live in independence of care. And 95% are living in communities. They are living at home. They are caring by their families. And we are not talking about the few ones. We are talking about 10, 12 million people in the Latin America and the Caribbean that live in this condition. So in this moment, it's especially important when as Sonja mentioned, when there are quarantine moments start to easy in many countries. We need to be careful how the families are doing the mechanisms that try to prevent that the people that are go out bringing the virus to the home. and affect especially these people with a high level vulnerability that they're living with them.
Okay, so we've started to get a few questions in from members of the public, but unfortunately none of the questions are directly related to either older persons or youth. So I'm just gonna reiterate that the experts that we have here today focus on these specific areas. So if you have any questions about COVID-19 in older persons or COVID-19 in younger persons, then please don't hesitate to ask us and we'll let the experts know. But if you have questions that are about symptoms or side effects or mask use or which public health measures should be taken, we will be having webinars every Thursday. So you can come back and check the theme of the webinar and by all means ask us those questions again. So we've spoken a lot about, families and, what people can be doing and carers that are looking after older persons. But I wonder what PAHO's specific recommendations are when it comes to the demographics that we're speaking about today. So older persons and youth in health systems. So what are we asking health systems to do in order to prepare to treat those people if they get COVID-19, and also particularly in the case of older people, but I guess it also applies to other youth-specific services, Sonia, to ensure the continuation of those services throughout the pandemic, because as you mentioned, Enrique, when this is not a short-term thing, that this could go on for a long time yet.
I think that many of the problems that we have now to approach COVID, many of them are structural problems that were before the epidemic in our countries. And then especially in the case of older persons, I am convinced that many of the things that we need to do were things that we need to do before the pandemic, and how to adapt our health system to these very quick demographic transitions that we have, not only because we are aging a lot. I mean, the population is aging a lot, but the more important amount of population now are living in their adolescent years. But they are, Sonia and us usually joke that the adolescent are older person in preparation. So they are living their life course, and that is a very important things for us. So many of the things that we are seeing is that only the 10% of medical school in this moment in the region, in Latin America and the Caribbean, have a specific program in geriatric medicine for students in medicine and nurse. So how approach the older person need to be improved. And this happened with a COVID. We now learn a lot that how the older person has not the same symptoms that young person. So many times the public health officials or the doctors or the nurse are identifying late the case of COVID in older person. So I think that in PAHO we have three major important fields that we would like to address in this moment. One is how we improve health service attention to the older person with COVID, how to improve the public health measure and the medical approach to the older person with COVID. The second one is how we could sustain essential health service for older person in the moment of COVID, in the moment of pandemic. So how we could, even so that the health services are very focused in approach to COVID, we need to maintain the control of the chronic disease, to sustain the daily needs, the social and health needs for older persons, and this is a very important point. And the third is how we can help to prevent the older person don't decrease their level of function in the way that they are becoming more in risk for future wave of the COVID infection. So we need to cover these three fields if we want to really don't have the same impact in other population that in our countries that has been seen in Latin America, in North America and Europe.
Right.
Maybe if I can add some when it comes to young people, adolescents and youth, we have been promoting at least that at least three things happen when it comes to young people, because we know that under non-COVID circumstances, young people already have barriers to access quality health services. So that's an ongoing area of work and technical collaboration that PAHO has with the member states. But in the context of COVID, mental health has become extremely important. And so we are promoting the ensuring that there are mental health services for young people. And I do want to congratulate some countries and professionals who have taken this on and who are giving courtesy mental health consultations free of charge. Several of them are sharing via social media saying, if you have an issue, call me. And so that's wonderful because the community is responding to that. Young people need to have mental health services, that's one. The other one is sexual reproductive health services, because sexuality does not end. The sexual development of young people does not end. So there's a continued need for information on sexuality and sexual health and services. Young people who are sexually active for contraceptives. And the other day we had also a webinar on addressing adolescent pregnancy, because the lessons we learned from other pandemics is that often there's a wave of unplanned pregnancies after that. And that's the last thing we want, knowing that our region continues to have the second highest adolescent fertility rate in the world. So we want to make sure that we continue the services, and that requires more intensified attention to inform young people where the services are, how they can access them safely. So that's important. And the third thing is violence, sexual violence. Young people are much more at risk now of sexual violence in the home and in their immediate environment. And so we need to make sure that we have mechanisms for young people to escape if they have to leave unsafe spaces, to contact care professionals in this context of COVID. If those three things we could do, then I think we can help young people to avoid some of the biggest harm from this epidemic.
Right. And I guess the violence aspect of the pandemic as well is relevant also to older populations as well, Enrique.
It is, and this is affect all the life course. But there is a risk group. I mean, women, child, older persons are the major usually target for violence during these people. And there is a lot of kind of violence, as you know, and these kind of things are usually part of their daily life in many of our countries, but in this condition are worse. And I think that, yes, definitely the older person are highly in risk for violence in this moment.
So we've had a few questions to do with the theme that have come in the chat. So the first one is for you, Sonia, and you mentioned the youth hangout, and Lauren wants to know if that is open to everyone and how young people can access that.
Yes, absolutely. It's open to everyone. And we have every Wednesday afternoon, we have 1 hour Spanish hangouts, and we invite all young people who prefer to communicate in Spanish to participate with us. We can share the link of that, the hangout. And then we have from 3 to 4 Washington time, we have the English hangouts. And they're wonderful because young people are organizing them, young people are leading them, and they have a wonderful time communicating with each other about their issues, their concerns, their questions, but also positive things. They're tips for each other, how to deal with certain circumstances. So those are very, we invite all young people to join us every Wednesday afternoon.
Brilliant. So Lauren, what we'll do is after this session is over, we'll get the link and we'll put it in the comments section. So just come back and check. This will still be here on the PAHO's website, and we'll just add it in there so that you can join and get your friends to join as well. So the next question we have is from Elena Cotelo, who says, what do we think about the meetings that we've seen going on? So I guess I've seen this on the internet, between grandparents and grandchildren in an open space such as a park. So I guess as countries begin to lift restrictions, and we've certainly spoken about, you know, when and how restrictions should be lifted in previous Ask the Expert sessions. Is it dangerous for grandparents to be having this contact again?
You know, this epidemic moment is a very is about the balance. You know, you always have a risk. You know, ever in your home, even you with your family, or even you have some risk. You go out to discard your anything and you can get it because you touched something. So it's a balance of risks. And I think that always you get some risk, but you need to also balance what you are getting of. As I said, you, in the way that you reduce as much as possible the risk and increase as much as possible the good results, that is good. I mean, I think that you can go there and you see how it's you see in internet many examples how people are going to the nursing home and then they're saying hello their grandparent over the glass and everything. And I think for older person in special, this is very good. And all we know that there is a special chemistry between young people, adolescent, and child with grandparents. You know, they have both has this special chemistry that the parents don't have usually. So I think that both parts are looking for them. And but for other person, I think that is very important. What we learn in this condition of the COVID, you know, actually, is that the older person usually don't have afraid to die, but they have a lot of afraid to die alone. And this is what happened with this communicated disease. That as you prevent that they touch, and they have many of them when you're talking with them say, you know, I am very afraid that I will die without taking the hand of my child or be close with my dear parents and so on. So I think that this is a very good connection, and I thought that it's a balance. I think that if we can avoid as much as possible the risk, and we could increase as much as possible the benefit, that would be good. And I would take just a minute to say that we saw we have some concern about some measures that some countries are taking that says, you know, they prohibit that the person over 60 can go out, or it start to some measure that are getting about or using age as a marker, and I think that this is a very bad decision. I always say that when you see that Dr. Fauci in the US, that is a leader of managed COVID, has 75 years old, you see that well, how we could work about COVID without the older person going on. So it's we need to consider all these areas when we are promote and when we limit the older person's participation in activities.
Yeah, and I guess that goes back to your point as well about, you know, when we talk about older persons, when we talk about youth, we're talking about huge demographics. And of course, you know, many of the world's foremost experts in communicable diseases and in virology are over the age of 60. And again, it also emphasizes the point that physical distance doesn't necessarily mean social distance, and that there's lots of ways, creative ways, that we can go about ensuring that human beings maintain that fundamental need to stay connected to each other regularly.
Yes.
We have a few more questions. So we have one from Lisa Bailey, who wants to talk about, given that many countries are planning to reopen soon, so to start reducing the physical distancing measures, how can young people and older people start to manage anxiety that might occur around that?
That's an excellent question. And what happened yesterday in our hangout with Caribbean young people, actually some voiced that. They said, I'm getting paranoid and I'm feeling very panicky thinking about going back to school and also about their smaller young, brothers and sisters going back to school. And so we discussed that yesterday in the hangout, that one, that we understand that they do feel that because there's so much on that is beyond your control. And there's young people who say, in my classroom, I cannot imagine, because they say there might be guidelines to social distance, but they say, I cannot imagine how I will social distance. And young people like to hug each other, children like to. And so what we said is, what is within your control is recognizing that we are living in a new normal. And that goes also back to this living in the, meetings in the park. The new normal is that things that we have learned in the past, hand washing, proper sanitation, now take on a new urgency. And so what is within your control is make sure that you practice that. What is beyond your control and that you see as a risk is to communicate to a person who might be able to change that. The teacher or somebody, young people have a voice to say, hey, this is unsafe. How can we work with you? How can we give ideas to change that? And then what is totally beyond your control is to accept that we live in a world where there's always, I think it's really important what Enrique said about the balance. There's always a risk. We might not even know how many risks we had in the past. Now we know the risk. And so I think it's first acknowledging that they do have these feelings. They really do, because they said it. And then trying to give them the tools to deal with it. But there will always be this issue of uncertainty that we will all need to learn to live with until we have this thing under control.
We have thank you, Sonia. We have a question from Artan Jama from Jamaica, who again is talking about the public health measures, and considering that older adults fall within, what we're referring to as vulnerable populations when it comes to COVID-19, and assuming that this virus is going to continue in circulation for the foreseeable future, how are we expecting older people to remain indoors for potentially the next 18 months, he says, and how will that happen? What might that look like?
Yes, actually, I think that, of course, we will not expect that the older person live confined for the next 18 months. And I think that many of the measures of confinement around this was to try to limit the epidemic proportion. Mm-hmm. And we need to try to continue to maintain that in a level that we could manage in some way. I think that there is two factors for me that are important in the older person. One is the virus and how we could generate barriers to the virus be part of the house or the institution and so on. So all the measures that we know that Sonia mentioned many times, wash your hand, cover your nose and your mouth with a mask, I think many things that limited the possibility that you get the virus. And the second thing is how you increase or decrease your vulnerability, increase your capacity and decrease your vulnerability. But because we know also that now we are learning more and more that, for example, when we are doing testing in universal testing in some places in US or Europe, we learn that many seniors, older persons get the virus and were not even sick, or they were not even symptomatic. But and we learned that many of them, even with 100 years, get the virus and we're okay. they pass a virus. So we need to maintain and sustain as much as possible the prevention measure, but at the same time, we need to decrease vulnerability. And that means sustain a very strong physical and mental health, especially physical health. We think that the function, the capacity is a very protective factor for older person. The second is try to maintaining under control the chronic disease, the diabetes and the sustain. And I think with all these measure, all this balance, I think that we will see a decreasing of this proportion. And we are learning, especially in countries from Asia, in Singapore, in Korea, in Taiwan, that there is a lot of experience that can give us the knowledge that the older person can be doing fine in this condition.
Right. Brilliant. Well, I just have one final question for you both before we end today's session. Given that a lot of our audience members are most likely to be members of the public and are likely to have both young people and older adults in their families, I just wondered if there's any recommendation that you might have for someone like me, for example, that doesn't fit really into either category, for making sure that the loved ones that I have that are older and the loved ones that I have that fall into the youth category are as safe and as looked after as possible, particularly given the stage of the pandemic that we're at now, where most of us have been on lockdown or some other degree of public health measures for, I mean, I've lost count now, but 60 plus, maybe 90 days now.
Can
I start?
Yeah.
I think when it comes to young people, to adolescents in our household, there are a few things that I consider important. One is something we have touched upon a little bit, is to limit their use of social media. And we are on Facebook now, so that sounds a little...
After this one.
After this session. But the thing is that our young people, in comparison with other age groups, adolescents and youth consume social media more than any other group. There's a lot of misinformation there, a lot of myths, a lot of things that create more anxiety than necessary. That's one. And the other one is also that there's some physical consequences from being online all the time. That can range from headaches, poor sleeping, etc., to quite severe consequences from being on social media all the time. So I think that helping our young people to maintain a routine that has a little bit of balance. Say, okay, every day you will take a break. You can be on social media for learning, for fun, for connecting, and then we will go for a walk. Having this balance, this healthy routine, I think is very important, maybe now more than ever, where we're forced basically to spend so much time together. And then the other thing that I feel is very important is for us to acknowledge them, because nothing matters more to young people than being acknowledged as a person who has feelings, and their feelings are okay, who feels that they are recognized. And so I think that's really important. Give them time, talk to them. If they say, oh, I'm really worried, say, okay, I hear you. How can I help you make this better? So this is a time where we can continue building our relationships with our adolescents, with our young people, to help them get through this. Because they do suffer, they do have questions, they do have anxieties. And this is a moment that will pass, but it will not pass quickly. So it's really important to maintain open lines of communication and make that extra effort with them to understand them and recognize and acknowledge them and their feelings.
Brilliant. Thank you, Sonia. And for older persons?
Exactly the same. If you move a young person and put the older person, it's the same.
Right.
It's the same.
Stay off social media.
It's different kind of social social media, maybe it's TV or instead of social media, and how a lot of news all the time get fair, and you cannot sleep well. The importance of routines, conserve a routine, the importance of communication. It's so important in multi-generation. The important that unfortunately, in the many political speech and many things, the older person sometimes feels responsible for what happened. The people cannot go to work because of them, because they can die or they can sick, and there is a sort of kind of responsibility that they are on their shoulder, that we need to remove that kind of responsibility for them. But the amount of ideas that Sonia mentioned is applicable for a family, for older, young, and even middle-aged persons that are at home.
Yeah, so we just need to look after each other.
It's overall life course.
Yes. Awesome. Well, thank you so much, Sonia and Enrique, for taking the time to participate in this week's edition of Ask the Expert. We will be back next week in Spanish again and in English for another edition of Ask the Expert. We'll start publicizing it a couple of days beforehand on our Facebook page and social media platforms, so please don't hesitate to join us. And thank you once again for taking part. Bye-bye.
Bye. Thank you.